everyone, it's Sarah with RegisteredNurseRN.com, and today we're going to go over the most common interview questions you may receive in an interview as a nurse. Before you even go to your interview, you want to prepare for it. In the previous video, we talked about how to prepare for an interview. So after this video, be sure to watch that video to learn how to prepare for it. But in this video, I'm going to cover the top 21 questions nurses reported being asked in an interview. After you watch this video, I really recommend that you take these questions that I give you, write them down, and practice them with friends and family to help prepare you for your upcoming interview. This information comes from the book I wrote, Nursing Resume, A Job Guide for Nurses. It's a little excerpt in the job guide, and this job guide comes with 10 resume templates and cover letters that are professionally designed to help you get that job. So, to prepare for your interview, you want to know what type of questions you may be receiving because you want some great answers to these questions and you don't want to be caught off guard. So let's get started. The first question, do you find the field of nursing difficult? A very common question because they want to see what your perception is on the nursing field. Question 2, do you prefer working with others or by yourself? Depending on the type of job you're applying for, a lot of nursing work is done in teams. So they want to see if you're going to work good with others in a team. Or if you're working in a lone position, maybe they want to see how well you work alone. Number 3, are you interested in advancing your career someday? This is really important. I was asked this question whenever I applied to a job because they want to know that you're willing to go and get educated, you're willing to get certifications, you're willing to move up. It looks really good for managers, so that's a common question. 4, are you a self-motivated person? Explain how. Being a nurse, you have to be self-motivated because you're on your own and you have to work autonomously. Question 5, how would you handle a situation where your replacement doesn't arrive? As a nurse, sometimes this happens and your employer wants to know, how would you handle it? Are you going to freak out or are you going to be calm, collective, and keep working until your replacement gets there? Another good question. Question 6, what is the most rewarding aspect of being a nurse? That is a really big question because that question tells them a lot about how you feel about the nursing profession and if you're passionate about it. And if you're passionate about it, that will come across in your work. Number 7, how would you handle patients who constantly complain? This definitely happens. No matter if you're the best nurse ever, you will have at least one patient complain through your career. So they want to know how well you'll handle that. Number 8, what do you think is your biggest contribution to your patients? This is your time to shine and explain your qualities, your strengths to them and how you are as a nurse. 9, how would you handle a patient's family member who is unhappy with your care? Again, you can be the best nurse in the world, but this does happen and they want to know how you're going to handle it. And this question might catch you off guard, but try to handle it the best you can. Number 10, how would you handle a rude doctor, supervisor, or coworker? This is a great question for them to analyze how well you handle conflict. 11, how do you deal with the stress of your job? Nursing is stressful, and in order to prevent burnout, it's very important that you do things whenever you're off that help relieve that tension and that stress. So that is how they're asking you that question, to look to see how well you deal with stress and what you do to relieve it. 12, what made you decide to become a nurse? Again, another question to see your passion in nursing, to see why you became a nurse, not just for money or for benefits, but your real reason. 13, are you affiliated with any professional nursing organizations? They're wanting to know how much you're involved in the nursing profession. Are you in clubs? Are you in associations, anything like that? They want to know how much you love the nursing profession. 14, how has your nursing program prepared you for your career? They want to know your take on your nursing program and if you're confident in the education that you received. 15, what do you do in order to keep up with the latest nursing practices and findings? They want to know if you're seeking out education opportunities, if you try to get certified in certain things, if you're keeping your skills up to date. 16, what do you think are the most important skills that a nurse can have? Again, this is asking you what you think are the best qualities of a nurse, what skills are important in working as a nurse. 17, what made you decide to leave your current position? Tip, always say something positive even if it may be negative, because it's not good, as the experts say, to put down your other employer to your potential employer, because they think, hey, they might be putting me down behind my back. So always try to be positive, and just always a safe answer is, I was looking to further my career. 18, how do you handle the day-to-day aspects of nursing? They want to know how you juggle a lot of things that you have to do, because whenever you're in floor nursing, you have a lot of duties you have to do. So how do you juggle that? How's your time management? So they want to know those things. Hey, 19, how do you handle emergency situations? This would be a good time to try to shine and talk about an emergency situation you had, given an experience, and just show that as a nurse you can handle emergencies, because that is really what your job is about, is handling emergencies. 20, what attracted you to our organization? This is where you want to talk about their mission statement. A lot of hospitals have mission statements, their philosophies and values, and you want to make sure those match up to yours, and just explain to that manager that you've researched that and that you find that those values match up with theirs. That'll really impress them, because managers they know the missions of the hospital, the mission of the hospital, and the philosophies. So that would be something really good to answer for that question. And our last question, 21, how have you assisted coworkers in the past? This is again about teamwork. They want to know. This will be another great time to give an experience of how you've helped a coworker in the past, because teamwork is very vital as a nurse. We all have to work together as a team in order to get through everything. So that was the most common interview questions that nurses have received in their interview. I hope this helped you out, and be sure to watch that video, how to prepare for the interview. And thank you so much for watching, and please subscribe to our YouTube channel.